Hello, I'm Dr. Fred Ferlic, South Bend, Indiana. I'm an orthopedic surgeon of 40 years. I took care of Notre Dame teams for 30 years, and I'm here to tell you about the TayCo external ankle brace. It was invented at the University of Notre Dame by Mike Bean, a trainer, for sprains on the football field. He could not get players back on the field same day, same game, when he just taped and used air cast. So he invented an external brace that fits over the shoe, so it fit over the football shoe. And the players were able to come out with an ankle sprain, and he was able to put it over their shoe immediately and then spat it on or tape it on. And they went back and played. In fact, the universities used it on numerous players the last 2 to 3 years. The reason it exists is because it provides stability and function outside the shoe. It allows the player to move his foot up and down and yet prevents inversion or eversion or prevents a sprain. So we've had great success on the athletic field. Subsequent to this, we were approached about using it for other patients besides football players. Therefore, we expanded it to the workman's compensation patient who has to wear a steel-toed shoe, so we have a special TayCo external ankle brace that measures for a steel-toed shoe. And we also went to the regular patient who suffers from a ankle sprain, ankle fracture, whether it's been fixed or not, posterior tib insufficiency, any neurological disease such as multiple sclerosis, Parkinson's, Alzheimer's. The brace is meant to stabilize people so that they can walk. I believe the TayCo external ankle brace will potentially replace all cam walkers, which are those large black boots that you cannot function in. You can't drive with this, you can't shop with this, you can't walk with this outside because of the bottom surface. It weighs 3.5 to 4.5 pounds. The TayCo external ankle brace weighs 12 ounces. It'll also virtually replace all long-term cast, because we all know what cast can do to an ankle, the skin, and the atrophy. The muscles cease to function if you're in a long-term cast. And it'll also replace most internal, inside the shoe AFOs, because these rub on your skin. If you have any kind of vascular problem or neuropathic problem, you get skin ulcers, and you can't use your own orthotic. With a TayCo external ankle brace, you can use your own orthotic inside the shoe. There are 2 types of TayCo external ankle braces that fit over the shoe or the working boot or the football shoe. One, we have a custom version, and the custom version is meant for long-term care. So if you had a patient with osteoarthritis of the ankle or rheumatoid arthritis of the ankle or a posterior tib insufficiency where their foot is collapsed or multiple sclerosis or Parkinson's or Alzheimer's that's always falling and they're breaking their hips, then you would want a custom model. That is measured in a matter of 2 minutes with a caliper and a tape measure on the patient's leg, either leg by the way, and also with 3 photos from your smartphone of their patient shoe. We're the only custom AFO that you do not have to cast. All other AFOs you have to cast. The second type is the non-custom, which is off the shelf. So this fits to a specific work boot or to a specific jogging or walking shoe. The non-custom or the acute or the off-the-shelf model you have stored in the physician's office, and he just asks the patient what size shoe, and then his assistant puts it on, which is very easy to do. Now, both in the custom and the non-custom model, We have 3 types. It's a range of motion, it's fixed, or it's 15 degrees plantar flex fixed for Achilles problems. Then you take the screw out to convert it to a range of motion. And I'm convinced, after 40 years of orthopedic surgery, that this is the most revolutionary non-operative device for ankles that's been invented. And I think that we're going to change millions of lives and help millions of people. Thank you.